health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Really a sincere pleasure to be with all you tonight virtually, and we have a lot of ground to cover. So again, I'm a minimally invasive specialist for avoiding dysfunction, genitourinary surgery, urologic oncology in the Philadelphia area. This is one of the topics that I think affects most men that come to see me, as well as by and large the majority of men as we age. So I'm really pleased to be able to do this with you tonight, answer questions in terms of diagnosis of BPH, as well as different treatments that are available. So we're going to start out with a general overview of the prostate gland, then we'll get into kind of more of the diagnostic techniques, as well as treatment options available. And we'll have some time for questions at the end. All right, we're going to start out with the prostate overview. So I'm going to draw your attention to screen right. And this is really a diagram of what the normal inner workings of the urinary tract are. So at the very top of that image, you can see a balloon type structure, and that's the bladder. The analogy I typically give my patients is that this is a water-filled balloon that's responsible for not only holding urine, but generating enough pressure to squeeze that urine out and pass that urine out of the body. You can see where the blue arrows are marked in this diagram. That's the urethral channel. And this is basically the tube that the urine passes out of the body, typically through the penis for most men. The proximal or inner portion of that tube, right next to the bladder, is actually made up of the inner lining of the prostate gland. So the analogy I give my patients is that the prostate sits like a ball around the tube that you pass the urine out of. And so you'll be able to see that as that prostate gland grows, it may cause an impingement on this tube and create issues with voiding, which we'll get into more in detail. So the prostate gland in general is primarily responsible for supporting the sperm and making the contents of ejaculation. That ejaculate passes through the tube and then out the urethra, the same track as the urine. Prostate glands typically grow to their adult size around the age of 20 and then continue to grow throughout a man's life based on the hormone influences like testosterone and different byproducts of those hormones. So this is a diagram that shows a few different conditions that can affect the prostate gland. We're going to start on screen left, and basically this is what the normal anatomy will look like. Again, the bladder that will hold that urine, and then the urethral channel, which is really open or patent, and the urine can flow easily when that bladder squeezes to push that urine out in a setting where the prostate gland really has not grown. Prostatitis, which is the next image over, similar to other areas of the body, the prostate is another organ that can harbor inflammation for a number of reasons. Sometimes trauma, sometimes infection, sometimes daily habits such as cycling or sitting for prolonged periods of time. Prostatitis can give some of the symptoms of BPH or enlargement of the prostate gland, but oftentimes manifests itself as painful voiding, blood in the urine or the ejaculate, and sometimes pain or discomfort in the saddle area underneath the scrotum. It can also occur in people with prostate glands of all different sizes. So if there's concern for this, this can be detected through meeting with a specialist from this standpoint. BPH, which is the next diagram over, this is really the focus of our lecture tonight. The prostate gland, again, continues to grow for most men throughout their lifetime. As that prostate gland grows, it will cause an impingement on that tube for most men and create a narrow channel where that urine may have a harder time flowing. The bladder may have to be in a more stressed state to push that urine out, and it may lead to you holding on to a degree of urine, which can cause the symptoms of BPH. And then prostate cancer, this is really to highlight that this is a very separate process than prostate cancer. Prostate cancer is a malignant or abnormal growth of the prostate tissue, very different than the benign growth or normal growth that occurs in the prostate gland, contributing to enlargement. So we're going to get into an overview of BPH or benign enlargement. What is BPH? It's exactly what it sounds like. So it is an enlargement of the prostate gland from a normal growth of the prostate cells or gland tissue. A normal size prostate gland is typically the size of a walnut, about 1.5 inches or so, but can range in varying degrees for most men. It's generally a slower process to allow this to grow over many years. BPH, as that prostate gland grows, you may have a situation where it starts to obstruct the urination and creates symptoms called lower urinary tract symptoms. So again, BPH is not prostate cancer. It does not necessarily cause prostate cancer. There are some earlier observational studies that actually say having a larger prostate gland generally has a lower incidence of prostate cancer, but some of those studies obviously need to be taken with a grain of salt. Overall, BPH symptoms or enlargement symptoms can have similar symptoms to an obstructive cancer process. But again, this is a blockage of the urinary flow, typically from a benign growth of the prostate. And prostate glands of all sizes could potentially also have a cancer process. The way to really know this is to meet with a professional and to come up with a shared decision-making approach to how to screen for prostate cancer. This is my pitch as a urologist. Our American Urologic Association typically recommends that we as healthcare providers engage with you to try to figure out the best ways to screen for this. There are blood tests called PSA. It's by no means specific for prostate cancer. There are certain things and many things that can cause a false elevation of PSA. Things like having a bigger prostate gland makes more PSA. Having inflammation in the prostate can release PSA at higher levels. And also certain activities like ejaculation or cycling can also falsely elevate PSA. It's important that you engage with your healthcare professional to come up with what screening approach works best for you. All right, so here's a side-by-side diagram of a quote-unquote normal urinary tract center screen, and then to screen right, an enlargement picture of the prostate gland. You can see that in the normal situation, the urine is emptying from the bladder and the urethral or the drainage tube is not obstructed by the enlargement. Conversely, on the screen right image, as that prostate gland has enlarged, it's pushing in on that tube and creating a more narrow passage for that urine to flow. Bladders that are blocked with prostate glands become stressed over time, and this can change the way that the bladder squeezes. In some situations, can cause permanent changes that may affect the way that you empty your bladder. It may cause you to hold on to more urine that will give you symptoms of BPH, and in some situations, men get to a tipping point where they can't empty their bladder and are thinking about things to help them to empty, like catheters. So what are these symptoms to look at for BPH? How can you evaluate to see if this may be something affecting you? Well, one of the most common symptoms is the frequent urination. It can happen both daytime and nighttime. Specifically at nighttime or early in the morning is when the bladder is a bit more sluggish, and you may notice these symptoms a little bit more robustly. Sudden urges to urinate mean that the bladder may be a bit stressed trying to push that urine out, and you may not be able to hold your urine as easily. A slow flow or a weak urinary stream, and trouble starting or stopping your urination could also be signs. In some situations, when the prostate gland has grown, you may have a very difficult time passing the urine, which can cause severe discomfort or pain. And that may be more of an emergency situation that you should get seen immediately. Most individuals with BPH may describe a situation where they feel like they have something left over even after they've gone and may have to return quickly to the bathroom. BPH in general can be a risk factor, one of the most common risk factors for developing a urinary tract infection in men. So there's a common misconception that UTIs are just a potential female-based pathology, but many men who have incomplete bladder emptying may have bacteria build up in that urine that is not draining. It can cause things like fevers, or in some situations, more severe infections that could be life-threatening. Similarly, stones can form in the urine that is not draining. The sediment in the urine that is trying to get out of the body can coalesce or build up when urine is not draining, and that can calcify over time, forming stones that can cause blood in the urine or pain even outside of urination. And the understated risk is the risk of bladder remodeling over time. If your bladder is stressed and it's trying to push that urine out, it will start to weaken over time or cause changes, even in the very early phases of BPH. This may be a permanent change, and it's important that if something is bothering you, that you get checked out from this standpoint to come up with what a best game plan would be. So BPH is a disease that can really affect a person's quality of life, not only for that individual, but also for their partners. Most people with BPH, when this becomes severe, know where every bathroom is, wakes up multiple times, which can also wake up your partner at nighttime. 95% of men who have symptoms that are moderate for BPH are unhappy and want something to change. Similarly, 50% of men may actually have sexual dysfunction or ejaculatory issues when their BPH becomes so bulky that it can obstruct some of the ejaculatory tubes. And 51% of individuals who have BPH say that it impacts at least one aspect of their life. So who gets BPH? Commonly, the growth of the prostate gland is a disease of aging. So I always counsel my patients that every man's prostate is going to grow with them throughout their lifetime. Some men's grow larger than others and can start to cause symptoms or bother. There are some other risk factors, things like obesity, specifically truncal or abdominal obesity, or lack of exercise that can make some of these symptoms a bit worse by either weakening the muscle or putting more pressure on the urinary tract. But by and large, there's not many dietary things that would influence the growth of the prostate gland. I find it striking that about 50% of men by the age of 60 will have at least some symptoms of enlargement of their prostate. And as we age further, you can see that 90% of men by the age of 85 will be affected with BPH. The statistic to the right, which is 14 million men in 2010, had symptoms of bothersome BPH or lower urinary tract symptoms. Some of that actually may be an underestimate, as many of these symptoms do not get reported as robustly as they actually are present. So how do we diagnose an enlargement of the prostate gland? Well, if you came to one of our urologic offices or even your primary care, there are a couple things that we can do to really help to figure this out. On the examination, there is a quick finger exam of the prostate gland. This is a gloved finger that's used to feel the prostate gland, typically done through the rectum. It gives us a lot of information. One, an estimate of the size of that prostate gland, and also helps to screen for things like cancer, making sure no nodules or no irregularity of the prostate gland. We couple this with other types of flow testing. There is Qmax testing, which basically this is looking at the flow rate of the urine that you pass. We use a cup or an instrument that has an ability to capture how quickly that urine is passing out of your body. Slower urinary rates may actually be consistent with an obstructed picture or the bladder not squeezing very well. And there are age-related norms that we typically will focus on to help compare. And then we couple this with the last part, which is basically an assessment of how much urine you hold on to after you've gone. We have you go completely, and we use a non-invasive ultrasound to see what is left over. We can pick up on any dangerous residuals that could be causing pressure on the urinary tract, and also help to kind of figure out if there is a next step that is needed as opposed to desired. And then the really important piece to this is how bothersome these symptoms are to you on report. So there are a number of symptom questionnaires that we utilize, the AUA symptom index, the IPSS, which is the prostate symptom score, and the quality of life questions, as well as bladder index. These are questionnaires that are given in our offices that basically allow us to gauge how bothersome some of the symptoms of BPH are. How often do you experience hesitancy? How weak is your urinary flow? Rate this 1 to 5 or 1 to 6. How many times do you wake up at night to go to the bathroom or urinate? How urgent is your urination? And then at the bottom, the quality of life scores say, as your symptoms sit now, how impactful is this to your quality of life? Not at all or terrible, indicating that we should engage with you further in terms of ways that we can figure out how to move this forward. So treatment options, we're going to go through a tour of different options available to you if you have BPH. So we'll start out with the least invasive behavioral modifications. We'll go into some office-based options that are very effective for treating BPH, including medications and minimally invasive procedures. And then we'll go into the more invasive options and traditional options at the end of the presentation. So we're going to start out on the more conservative measures. Watchful waiting. This is an approach where we recognize that there are symptoms of prostate enlargement or BPH. You've had an evaluation for this, and we can recommend to you either some lifestyle modifications, diet, healthy lifestyle, or exercise will only help to strengthen some of the muscles and help to reduce some of the effects of obesity on the bladder and pelvic organs. Regulating fluid, specifically at nighttime, may actually help with nighttime urination. What you put in does eventually, to some degree, have to come out. And so if you're experiencing nighttime urination, sometimes regulating fluid to less than a 6-ounce or an 8-ounce fluid serving may be appropriate to help with nighttime urination. The benefits of this type of approach would be you don't have to take a medication and you're not considering a procedure. But one of the understated risks is that if an enlarged prostate is present and your bladder is stressed, it will cause remodeling over time. And that could get to a point where, one, the bladder is not squeezing as well as it should and cause permanent issues in terms of your voiding pattern. And some individuals may actually reach a size of their prostate where some of the minimally invasive options are not an appropriate option for them. So we look into the first line therapies for this. One of the first line medications that we give, a very common one, is a class of medications called alpha blockers. This is commonly labeled as tamsulosin, which is Flomax, alfuzosin, which is uritraxol, or sildosin. These medications, again, I'll point you to the analogy of the prostate gland, like a ball that sits around the tube on the urinary tract. It works on the outside of that prostate gland on receptors to relax that prostate. By relaxing it, creates a wider channel where the urine will flow out of the bladder. These same receptors are on other areas of the body, including the blood vessels. So some individuals may find that it decreases their blood pressure. It is a light blood pressure medication, so if you are taking other blood pressure medications, this could have an effect. Sometimes this presents issues with dizziness or lightheadedness, and in severe cases can present with fainting. More so when you change positions quickly or bend from ground level to pick something up. Fatigue also goes along the lines with this. And retrograde ejaculation is a concept where if the prostate gland is relaxed, some of the ejaculate that is made may slip backwards into the bladder and come out with a subsequent urination. It's not a life-threatening or dangerous thing to you, but some men, and many men on some of these medications, may actually experience a decrease in the amount of ejaculate that comes out with sexual activity. Then you have the other class of medications that is also considered first line. This is a 5-alpha reductase inhibitor. This works a little bit differently. Sometimes is given by itself or in conjunction with the alpha blocker medications. This medication actually works on the growth signal to the prostate gland. So it actually helps to shrink it down by impacting the growth signal to the prostate. Not to get into the nitty-gritty of this, but it actually stops one of the forms of testosterone from being converted to another form of testosterone, which is the primary growth signal to the prostate. This may slowly shrink it down, and the imperative term here is slowly. This is a medication that is not instantaneous. It will take sometimes up to 3 to 6 months or even longer to be optimized. So you will not see an instant response with this medication. It will actually affect your PSA values or your prostate levels. So many of us who are screening your prostate levels on a routine basis take this into account, and we make adjustments for your PSA because it can cause false elevations in folks who are closely monitoring those levels for prostate cancer screening. It may cause things like erectile dysfunction and lowered sex drive, and in some situations that are rare, breast tenderness. And then there's a third line of medications, again, not primarily geared towards prostate or voiding issues, but more used for erectile issues. And some of these medications, the way that they work is they basically dilate the blood vessels to deliver better blood flow into the penis. They may have a relaxation event on the prostate gland that creates a wider channel where the urine can flow. This is more so tadalafil, which is the generic form of Cialis as compared to sildenafil, and sometimes is given at a 5 milligram daily dose for both people who are suffering from BPH or prostate issues and erectile dysfunction. Because it dilates the blood vessels, you may get some flushing of the face, nasal or sinus congestion, in situations blurred vision or color vision changes, headaches, some heartburn, and one of the side effects may be a more robust erection, which is not a bad thing for most men. All right, so medications may not be for everybody. And one of the great first line options that I typically will engage with my patients on is to consider office-based options that are FDA approved that may help to shrink that prostate on a more permanent level and help you to avoid medications or come off of medications. One great option is the Resume water vapor therapy. So this is basically a non anesthesia based, so you don't have to go fully asleep with general anesthesia, done in the office with local anesthesia, a camera based option that will help to shrink down that prostate gland using natural water vapor therapy. Basically, we apply through a camera through the penis a steam treatment on several different areas of the prostate gland that are causing the highest degree of blockage. Most men will get between 4 and 6 of these 9-second steam treatments, all done in one procedure that takes about 15 to 20 minutes and is very well tolerated. The benefits of this is it physically shrinks down the prostate gland and is impacting that tissue compared to some of the other options available. And it's one of the lowest risks of any erectile or urinary leakage risks of any type of minimally invasive procedural option. Most individuals, because this is camera-based, non-incision-based, get back to activity as usual very quickly afterwards, within several days.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right, so I will just emphasize that this is a great option for individuals who either are not reaching desired outcomes or goals on medication therapy or don't want to be on a long-standing maintenance everyday dose medications long-term. This can significantly impact the way that you urinate in a positive light and may be a good option for some individuals who are wishing to avoid a more invasive implant. It's generally very well tolerated and recommended by about 97% of individuals who have had this in some of our studies. It does not require any implant, and the nice part is because it's water steam therapy, everything is still on the table. So you know, you haven't burnt any bridges necessarily by doing this type of procedure, with this significant benefit that it may provide better urination without medication therapy long term. And their surgical retreatment rate is actually very low, about 4.4% over 4 years. Prostatic urethral lift, commonly marketed as UroLift, is another minimally invasive option done in the office. This does involve a camera-based procedure again, can be done with or without general anesthesia. And we puncture into the prostate gland to provide these implants, which move that prostate out to the side. Basically, think about the analogy of opening curtains over top of the urethra and allowing the urine to flow a little bit easier. It's ideal for some shapes, but not all shapes of prostate glands or sizes. And one of the things to note about this is it's not physically impacting the tissue, it's more moving it out. Again, most other minimally invasive procedures can be done after a UroLift implant. Some of the side effects include blood in the urination, low risk of any urinary leakage or stone disease afterwards, and some pain with urination that lasts typically about a week or so afterwards. There is a higher retreatment rate of the prostate gland, about 8.8% to 13.6%, depending on the study you look at about 5 to 8 years. Green light laser therapy, now we're starting to get into kind of more procedures that are a little bit more invasive or disruptive to the anatomy. Basically, this is a procedure that is still very minimally invasive, done through a camera. We use a laser, a specialized laser, to vaporize that prostate tissue, create a wider channel for that urine to flow. Because we are physically vaporizing into that prostate tissue, there may be a higher risk of things like blood in the urine afterwards for a bit more time, pelvic pain or discomfort, or urinary frequency or leakage in very rare situations. But it is a very effective treatment, about 4.8% retreatment rate at about 5 years. This is done at some specialized centers. Transurethral resection of the prostate gland is one of the traditional ways of addressing the prostate tissue in an enlargement setting. This has been around for several decades, and basically the analogy that I use is, if you consider that prostate gland like an apple, we are coring out the inside of that apple to create a wider channel. This involves using a camera and a heated loop or a button, some type of heat energy, to shave or core out that tissue and create a wider channel for the urine to flow. Because you are physically cutting into the tissue, this typically is done with a general anesthesia procedure, may either be done as an outpatient surgery, which I do for most of my patients, or a one-night stay in the hospital. And the big thing to note here is that it will cause a degree of retrograde ejaculation, meaning decreased amounts of ejaculate coming out of the body. Because we're physically shaving away that tissue, that ejaculate will pass backwards into the bladder. In some situations, this could be permanent. So there are other treatments that are available, including HOLEP, which is holmium laser enucleation of the prostate gland. This is a more invasive laser therapy for sometimes larger glands, coring out the inside with a laser and then taking the prostate gland, a larger amount of that prostate gland, out through pieces of a camera. And there's also aquablation, which is a water vaporization of that prostate gland, which kind of fall in line with a little bit more of an invasive or a disruptive technique to the anatomy. Surgical prostatectomy is the option that is kind of the most invasive typically offered. We generally reserve this for folks who are not candidates for some of the other minimally invasive options, or who have too large of a gland or complex anatomy. It's done through an open incision or robotic surgery through the belly, so incisions to do this. We either cut through the bladder or go around the bladder to take out the meat of the prostate gland on the inside. So the analogy I use is a walnut gland with the shell around the outside of the prostate. We core out the inside or the nut piece of that walnut and leave the shell in place, which becomes a tract where the urine will flow. Because this is more invasive and more invasive to the anatomy or disruptive to the anatomy, there is a higher risk of bleeding or blood transfusion. In some situations, infection, which can be severe, and certainly a degree of retrograde ejaculation. This is not done as an outpatient surgery, typically requires multiple days in the hospital with a urinary catheter to help rinse out the bladder for several days. So this is just a general good practice for patients who are considering any type of BPH therapy or any therapy in general. Check with your insurance providers, as most of these are covered entities, everything that we talked about in terms of treatment. We also have specialists through our offices or many urologist providers that you may be seeing who can help to work with pre-certing or pre-credentialing these procedures and help you navigate this process. So use the resources available to you and engage with your healthcare provider. So in summary, we did a whirlwind tour of BPH or enlargement of the prostate gland and the treatment options that are available. The prostate gland is a walnut-sized organ, but may be larger in some individuals, and it is positioned around the tube that you pass the urine out of. As that grows, it will push in on that tube and create a constriction for some men over time. This will cause symptoms of bother with urination or difficulty passing the urinary stream for some men. As we age, our prostate glands are going to grow with us, and this will affect most men as we age to a certain degree. Enlarged prostate glands or BPH. We also went over a whirlwind tour of conservative to more minimally invasive first-line therapies, either medication, Resume, or Urolift, or some of the other minimally invasive techniques, to more invasive surgical procedures that may be best suited for some people based on the size of their prostate or the complexity of their anatomy. All right, so there are reimbursement hotlines and specialists, both through Resume and some of the other procedures that can be utilized. And this is really kind of my conclusion slide and pitch to individuals who are having symptoms that they are concerned about to any degree. If there is something that is bothering you, whether it's inside the urinary tract or outside the urinary tract, something that is of concern, it is absolutely in your best interest to get checked out or to meet with a specialist or a professional who can help you to sort through these symptoms and really uncover if this is something that we can move forward for you meaningfully. There are a lot of great options specifically for the enlargement of the prostate gland space, and it is really a great practice in something that we can guide you through in terms of how to best move forward with some of the symptoms that are causing a distress to your life. I always say to my patients, information is power, and that rings true, no truer than in healthcare. When it is coming to your health, you can't ask for a situation where more information would be a better tool for you in terms of helping to navigate or move forward with your symptoms. So if there's anything that we or a healthcare provider can be of assistance with, I would encourage you to meet with them and then to have this discussion for your own health. So again, just a sincere gratitude to Boston Scientific, who is one of our co-sponsors for this, as well as the MenMD team. We'll open up the floor for questions, as I know we have a lot of these.
The first group that we're going to get to is covering some prostate questions that we received with our registrations. So the first question here is, what does it mean if your prostate can be seen in the bladder during a cystoscopy?
Yeah, very good question there. Was there another part to that?
That was the whole question.
Okay, great. So a cystoscopy or a cystoscope is a camera that's done for a diagnostic purpose, taking a look at the inside of your urinary tract. This is done for a lot of different reasons, but actually looks at the prostate gland on the way in because it forms that tube that you pass the urine out of. Having a prostate gland that has grown into the bladder just means that it is a normal type of enlargement that can occur for some men. The prostate gland can either grow in from the sides, like curtains blocking that urinary tube, or it can actually have a third lobe for some men that is normal anatomy and protrudes into the bladder. It may, based on the size of that inner lobe of the prostate, open up the possibility that some treatments are going to be better options for you, specifically, urolift, which is the implant surgery, is a little bit better suited for the lateral lobe growth. Resume or TERP or some of the other treatments may be a better consideration in those types of settings with a bigger lobe on the inside.
All right, you may have covered this briefly during the event, but what are the sexual effects of enlarged prostate?
Yeah, so in general, the nerves that supply erections course along the outsides of the prostate gland. Even in enlargement of the prostate situations, that's not the primary reason why most men may experience erectile issues or erectile dysfunction. By and large, because the prostate is an ejaculatory organ and helps to contribute to that volume to support the sperm, having an enlarged prostate as that gland grows may push on the tubes where the ejaculate comes into the urethra, and some men may experience an age-related decrease in the amount of ejaculate that they make. So enlargements of the prostate can contribute to ejaculatory issues when prostate glands become larger.
All right, next question here. My prostate increased from 19 to 40 in a year. Is there cause for concern and a way to slow further increase?
So that's a very good question. And obviously an individualized evaluation here, there are some factors that could be contributing, but sometimes that's the difference between the way that the prostate gland was measured, either with an ultrasound versus another image or just a finger exam or camera-based evaluation. So there are differences between how prostate glands are sized that may be contributing. Sometimes prostate glands can grow quickly, but generally this is a slower process. Is this a cause for concern? It's very difficult to say that. What I would encourage you to do, obviously, is if you're seeking an evaluation, there are ways where we can figure out in conjunction with things like prostate levels, PSA, or some of the other diagnostics to figure out if that is something that is contributed to by just the prostate growth or if there is something else at play there. Sometimes swelling of the prostate gland can actually cause a more quick increase of the size of the prostate, so that could also be at play. Is there something that you can take to help to slow that process? That would be like the 5-alpha reductase inhibitors, the things like finasteride, which help to shrink down the prostate. Saw palmetto is a natural substance that may also slow that growth rate, but it is a slow process and may be incomplete for some men.
All right, next question here. Can an enlarged prostate be treated with natural supplements?
Yeah, good question. So there's been a lot of different things studied in the literature from this standpoint in terms of dietary or natural substance. Really, the prime natural herb or supplement that has been shown to be at least to some degree efficacious here is saw palmetto. So basically this is, it works actually very similar to Proscar or finasteride, the medication that shrinks down that prostate gland to a lighter effect, albeit, but in some men that may actually keep the prostate gland a little less swollen over time and may kind of decrease the growth signal to the prostate gland. In some men that works well for them in terms of impacting their urinary symptoms, but in a lot of men this may not be the only solution.
All right, next question here. This person asks, how do I reduce prostate inflammation?
Very good question. So again, prostate gland can be a common place where some men may harbor inflammation for a number of reasons: infections, turbulent flow of urine, stress on the prostate gland to push that urine out over time, or certain activities like cycling or pressure underneath the scrotum sitting for long periods of time. Is there a way that you can reduce the inflammation of the prostate? Yes, there are effective anti-inflammatories that are geared towards the prostate gland. Some of the natural, more conservative things that you can do: use cushions when you sit on harder surfaces. Try to avoid prolonged periods where you are sitting without at least taking a break to stretch your legs. Soaking in a warm tub with some Epsom salt may actually help to draw out some of that inflammation. If you did that several times a week for 15 minutes or so, that may actually help with that process of inflammation. And some things like anti-inflammatories, if these are safe medications for you to take with your other conditions, may actually help to reduce inflammation in the prostate. Some of the prescription medications like finasteride may also be used to this capacity.
All right, going to get into some more BPH specific questions here. This person asks, it may sound crazy, but does manual prostate massage reduce the size so urination is easier?
Yeah, so actually, this is not that far out of a question. I actually receive this question very commonly in my practice. And so, again, the prostate gland is a organ that can harbor inflammation or be congested for a bunch of different reasons. Sometimes a massage of the prostate gland may help to release some of that ejaculate a little bit easier. That actually used to be a way or a technique utilized to diagnose inflammation or bacteria in the prostate gland. In terms of like a routine practice or self-massage, I don't know if there's much data to support that necessarily. I think you're better served by doing things like reducing pressure over top of that saddle area underneath the scrotum. Folks who cycle consistently may think about using a split seat or a gel seat that may put a little less pressure on the area in the perineum underneath the surface of the scrotum, or soaking in a warm tub. Taking anti-inflammatories may be better suited.
All right, next question here. Can BPH share symptoms with other ailments?
Yeah, very good question. So we showed that one slide tonight that basically shows a couple of different conditions that can affect the prostate gland: inflammation in the prostate, an enlargement of the prostate, prostate cancer. So yes, anything that causes a flow obstruction or a blockage or an impediment may actually give you a symptom similar to BPH. Sometimes even scar tissue in the urinary tract may be something that may obstruct that flow and create a situation where you're not emptying your bladder. These are the types of diagnostic evaluations that can be really helpful to work through with your healthcare provider, because there are ways that we can tell or give you more certainty as to which one is at play and how we can be most targeted about addressing it.
All right, and another question kind of falls along that. Could you please elaborate on the less invasive options for differentiating between BPH and prostate cancer, and
Sure.
other than a biopsy?
Yeah, so again, prostate cancer is not BPH or an enlargement of the prostate, but PSA is one of the kind of tried and true screening methods for this. One of the most common things that's utilized is a blood test, but by no means is specific for prostate cancer. So again, an enlargement of the prostate, inflammation in the prostate, all those can cause a release of more PSA that's picked up on a blood test. The thing we screen for is prostate cancer. So PSA in and of itself is not an evil number. It is something that we use for a diagnostic to say, listen, is there something that we need to look into a little bit more closely? Also, when you give a PSA test, avoiding things like cycling or pressure activities underneath the scrotum for several days before, avoiding any type of sexual activity or ejaculation can give you a more true baseline. So just good practices when you submit that. There are things outside of a biopsy, like MRIs of the prostate, that can look at cross sections of the prostate gland. This is actually very sensitive for picking up on clinically significant prostate cancer, but may miss some low risk prostate cancers. There are urine studies, things like Select DX, which is basically a test of the urine after a prostate examination, which looks at a risk of detecting cancer if you were to proceed with a biopsy. There are things that are different variations of PSAs that may help to risk stratify that number, such as total and a free percentage PSA, which is best for individuals who have a slight elevation between 4 and 10 for their PSA. So yes, a lot of different things out there. It's very helpful for you to engage in an individualized approach to that diagnostic with your healthcare provider, who can definitely guide you through this.
All right, next question here. Any recommendations for stricture urethra treatment?
Yeah, so stricture disease is a common terminology for scar tissue in the urination tube. Typically, this affects the outflow tract of the urethra, the tube that drains from the bladder and comes out of the body through the penis. It can happen for a lot of different reasons: infection, inflammation, trauma, or previous surgery. Stricture disease is managed a little bit differently than just an enlargement of the prostate. Medication therapies are generally less effective there. Depending on how severe that narrowing is, it can impede the flow of urine, just like BPH. Many times this involves a procedure, either with a dilation to stretch out that scar tissue. In some situations, a procedure to cut into that scar tissue and release any obstruction. And in some severe situations with longer segment strictures, we really think about more of a surgical approach to reestablish the patency or the opening of that tube, either through using natural tissue around the urethra, or sometimes other substances in the body, like the inside lining of the mouth, called a buccal urethroplasty. That type of evaluation is really dependent on the type and the extent of the stricture.
All right, next question just came in actually. Does testosterone therapy increase the risk of BPH?
Yeah, so very good question. Again, one of the influencing factors for enlargement of the prostate gland is a form of testosterone called dihydrotestosterone. Regular testosterone being at higher levels in the body, some of that will get converted by a protein enzyme in your body to this dihydrotestosterone, which influences prostate growth. It's not a one-to-one guarantee that having more testosterone in your body is going to cause a higher growth of your prostate gland, but there are ways that you can track that over time with evaluations or tracking your urinary symptoms on testosterone therapy to see if this is impacting it. By and large, testosterone is meant to be at kind of a normal value for most men. It sits at a regulation level with some of the other hormone influences in the body. And so having a testosterone within a normal level, quote unquote, wouldn't necessarily put you at a significantly increased risk of driving that prostate growth compared to what your body would normally make.
All right, next question here. What should you do before you have BPH to lessen the chances of getting an enlarged prostate? Are there any diets or exercises that are specifically recommended?
Yeah, so very good question again. There's not really been things that have been robustly proven in the literature from a dietary standpoint to help reduce the size of the prostate gland. By and large, there may be some genetic predisposition in folks who family members have had bigger prostate glands. Your gland may be kind of just based on the normal growth pattern, develop into a slightly larger gland. You know, activities that can reduce swelling of the prostate gland, cycling, or you know, kind of just general healthy practices, routine diet and exercise may be of some effect, because by reducing obesity, specifically abdominal obesity, it will put less pressure on the pelvic organs. Saw palmetto may be a reasonable natural supplement for some men to help reduce prostate growth over time. But may have some of the side effects of things like finasteride, which is a decreased libido or sex drive for some individuals, and in rare situations, erectile issues. So the way to really know would be to try the medication. If it's bothersome to you, you can stop that or consult with your healthcare provider to come up with a game plan from that standpoint.
All right. Next question here. UroLift did not help me. Is that normal, and what's next for me now?
Yeah, so this actually is a very good question, because you know, some of these minimally invasive procedures, I mean, again, these are geared towards the prostate gland. So UroLift is not for everybody. It's not for every size prostate or every shape prostate. But the goal is, again, to achieve a nice open channel where that urine will flow. The other piece to avoiding issues is how well that bladder is generating a pressure or squeezing over time. Remember, if the bladder has been stressed or you've been blocked for a long period of time, the likelihood is that that bladder has become weak or strained, and it may not squeeze. The muscle tissue in the lining of that bladder may not generate enough of a pressure to help that urine to flow. So some folks with long-standing prostate blockages may get to a situation where it will take even time further after their BPH treatment to see an improvement in terms of their urination. But remember, some of that remodeling of the bladder may actually be permanent in some situations. So there is a test called a urodynamics done in the office that can help you to figure out if the bladder is more of the culprit or if the prostate is still obstructing after that. That could also be done with another camera look to see how open the tube is. And so that urodynamics is an office-based 1-hour procedure where basically we fill up the bladder, we read pressures as the bladder fills, and then we have you urinate. We see the pressure the bladder is generating, and based on that pressure and the flow outside of the body, we can really determine, is this more of an obstructive outflow problem, or is this more of a problem with the bladder muscle just being weak? So that may help to clarify it for you when engaging with your healthcare provider.
All right, got sort of a follow-up question to that, and kind of a UroLift versus a resume question here. I have all of these symptoms, cath 8 times per day to empty the bladder. Urologist said I need either the UroLift or resume. Is one better than other?
Yeah, so I would say that this really depends on the size and the shape of your prostate gland. There are restrictions for either one of those procedures in terms of the size, you know, and the shape of the prostate gland. So an engagement with your provider in terms of the shape and the bulk of the prostate gland may help to determine that. I generally, in my practice, say folks with a bulky third lobe of the prostate gland, again, 2 lobes growing from the outside or push on that urethra. Some folks have a bulky lobe in the bladder. If you have a larger lobe in the bladder, I generally say UroLift is a little bit more difficult to execute, and resume may be better in that situation to optimize the outflow.
All right, got another resume question here. With resume, how soon can I expect to see improvement with my symptoms?
Yeah, so the counseling that I typically give patients is initially you will reach the way that you urinate prior to the procedure as that inflammation reduces. Everybody's a little bit different in terms of the time frame it takes for them to process the inflammation, and we can give some medications to help really reduce that for you. But most folks reach where they were peeing before the procedure at about 3 to 4 weeks after the procedure. Every week thereafter, most individuals see an improvement towards about 3 months or so, where with any procedure for the urinary tract, you're probably going to reach close to where your new baseline for urination will be. The common things that you'll experience after any of these types of procedures may be a little bit of irritation, burning sensation with urination, blood tinge to the urine. Many of us will give medications to kind of help to reduce that, but overall would be a well-tolerated treatment option for most.
All right, got another follow-up on the resume. Can I get the resume procedure if I am on anticoagulants?
Yeah, it's a good question. As somebody who does a great many of these types of procedures, I do offer these types of procedures if they have, if my patients have the right shape and size of the prostate gland and may not be able to come fully off of their anticoagulation. We oftentimes will engage with your prescribing docs for your blood thinner medications or anticoagulation to see which ones are safest to stop and if we can get any leeway in terms of stopping them around the procedure. But the nice part about resume is because it's not a general anesthesia procedure, and these are small punctures with steam treatment in the prostate gland. Generally, I've done these procedures on a number of individuals who have blood thinner medications on board that can't come off because it's the most well-tolerated option, and they can't reach where they need to get to with the medications or can't tolerate that. So yes, it's a possibility, but certainly your provider, your urologist would engage with your other docs about if there is a little bit of leeway to have you come off of those. And if not, it's not an impossibility to do that type of procedure.
All right, got another one for resume here. Will I feel anything during the resume therapy treatment?
Yeah, so the common thing that you'll feel is basically a little bit of cramping or a little bit of pressure as that steam treatment goes in. It almost feels kind of like a deeper cramping close to the bladder, almost like you have to pee, or an urge sensation. There may be some burning sensation when you urinate or as you're recovering from that procedure. There's two ways that we typically will give the anesthesia. We give a numbing medication in through the tube that leads to the bladder, the urethra, where we go in with that camera to do the minimally invasive procedure. Many of us will also give a medication that's an injection-based medication right around the prostate gland, done through an ultrasound down below, similar to a finger exam. It takes about 1.5 minutes to deliver that, and also makes the procedure much more comfortable. So the beauty of this is that because this is done typically under local anesthesia, as you know, you're going to be able, in most cases, to tolerate this actually very comfortably with those kind of combination of medication therapies. If not, it would be a procedure that you couldn't really accomplish in the office, which many of us, do this procedure in that setting.
All right, just got a good question from the crowd here. No problem with urination, but extremely painful ejaculation. Could this be related to BPH? I've tried several treatments. Next thing my urologist wants to try is TERP, but I'm concerned about side effects.
Yeah, so a very good question. And, the pain with ejaculation may be a symptom of some inflammation within the prostate gland. Painful ejaculation, blood in the ejaculate can come with inflammation in the prostate gland. There may be some therapies if you're able to receive an anti-inflammatory medication, that is focused on the prostate gland. There are things like meloxicam. That's a once-a-day anti-inflammatory I sometimes give to my patients in this setting to see if that helps to reduce that pain with the ejaculate. Without knowing the specific details of that situation, one thing to think about too is, if they feel that the inflammation may be related to an obstruction of the flow of urination, sometimes doing a TERP procedure or an offloading procedure on that prostate gland may help to reduce stress or pressure on that prostate, which could be contributing to the symptoms that you're describing with the pain with ejaculation. So it's a little bit difficult to really navigate that, but I would say, yes, it could potentially help to have that TERP procedure or a minimally invasive procedure. But if there is a prostatitis there or inflammation, one other means of addressing that may be to focus on that, see where you get to, as long as your residuals are appropriately low, and then re-engage about a procedure or another medication option from there.
All right, next question here. I've had BPH for many years now. What would be the reason for treatment now?
Yeah, so again, some symptoms and most men's symptoms with BPH are progressive. So if they are becoming more bothersome, or intolerable, that may be a reason to seek therapy. Some individuals start to retain more urine, which puts pressure on the urinary tract and can cause remodeling or sometimes permanent damage to the urinary tract. So if they're tracking your residuals over time, they're seeing those climb up, or your symptoms are becoming more bothersome, that may be a reason to seek therapy for this. Some folks get refractory urinary tract infections or stones within their urinary tract. Or have hospitalizations where they require catheters to help their bladder to empty. So if your bladder and your prostate gland are getting to a size where it's really at the tipping point where you're at risk for a retention, that may also be a reason to seek therapy now compared to years ago.
All right, and we are coming up on 6:30 here, so this is going to be the last question that we asked tonight. So here it is. What's the best alternative to tamsulosin? It makes me faint.
Yeah, so again, medications are not for everybody from this standpoint. So if an alpha blocker medication, which can have blood pressure effects, is not working for you, the other type of medication would be that 5-alpha reductase finasteride that shrinks down the prostate, may cause some decrease in libido or sex drive, is slower to work, but could be an effective option if taken regularly over about 3 to 6 months. Other options to consider there that I tell my patients is if the medication's not sitting well with you, think about some of these minimally invasive options. They are well tolerated, done in the office many times, and can give you significant relief without medication.
All right, and with that, I'd like to thank Dr. Laganosky for taking the time to present today, and we'd also like to thank everyone listening in for attending this MinimD to Focus webinar. We hope it was informative and that you'll join us again in the future. If you'd like to learn more about BPH, you have a few options. There are more resources in the Resource Center on minimd.com. Visit this page to view instructional videos, guides, expert articles, and much more. We just launched a brand new website that now allows you to compare treatment options. If you'd like to compare any of the treatment options we covered during tonight's event, you can do this by going to minimd.com, navigating to the BPH condition page, scrolling down to the treatment section, and selecting up to 3 BPH treatment options to compare. You can also call MinimD at 857-233-5837 or log into the password-protected secure MinimD portal to schedule an appointment with a MinimD personal health assistant. To learn more about Resume treatment options, the insurance coverage from tonight, you can visit resume.com. I'd like to thank everyone again for attending today's webinar, and we will see you at the next one.
Thanks again for having me. It was a pleasure to be with you.